Next, Dr. Rahul, you can start with the presentation.
Very good afternoon. At the onset, I'd like to thank All India's AIOC for giving me the opportunity to present our case on comparative study on rules of innovative bevacizumab versus biosimilar bevacizumab in the management of ROP. Excuse me. Yeah, so no financial disclosure associated with my studies. Retinopathy of prematurity continues to be a significant clinical concern in neonatal medicine, affecting the visual development and the quality of life of premature infants worldwide. The pathophysiology of ROP is intricately related to the aberrant vascular development with the developing retina of premature infants. As one of the leading causes of childhood blindness, ROP underscores the need for effective, accessible, and the cost-efficient treatment. Traditionally, therapeutic intervention of ROP have relied upon ablative treatment like laser photocoagulation, which while effective can carry the risk of peripheral visual loss and damage to the developing retina. So we all know the importance of VEGF in the pathogenesis of retinopathy of prematurity. Now, the advent of antivascular endothelial growth factors such as ranibizumab and bevacizumab agents have transformed the treatment of the landscape of ROP. Bevacizumab, a humanized monoclonal antibody targeting VEGF, has gained substantial attention for its remarkable efficacy in treating various ocular neovascular diseases in adults. Treatment with anti-VEGF injection lead to regression in the acute phase of ROP, as well as it enables the normal development of the retinal vasculature. These were the landmark trials of anti-VEGF in the retinopathy of prematurity. Initially, we had the BEAT ROP, then we had the Firefly ROP and the Rainbow trial, which showed the effectivity of ranibizumab. The introduction of biosimilars, which are biologic products that are highly similar to the reference innovator molecule, have the potential to revolutionize ROP management. They offer a unique opportunity to expand access to cutting-edge therapies while potentially reducing the economic burden associated with the disease. So our objective was to compare the role of innovator bevacizumab with an Indian biosimilar bevacizumab for the management of type 1 ROP. So it was an interventional single center study conducted at a tertiary eye care center in Jharkhand. The study period was from June 2022 to January 2024. It was carried out in accordance with the tenets and outlined in the Declaration of Helsinki, and after receiving approval from our institutional review board. The parents or the legal guardian of each child provided written informed consent for the treatment and the data collection. After doing a proper ROP screening, a comprehensive history and a fundus examination, we graded the ROPs by using the ICROP classification. Now, type 1 ROP was characterized as any ROP with plus disease in zone 1, stage 2, 3 ROP with plus disease in zone 1, and the third was stage 2 or 3 ROP with plus disease in zone 2. Infants with type 1 ROP received 0.625 milligram of intravitreal bevacizumab, both innovator and biosimilar, in the operation theater under aseptic condition. Those eyes whose ROP worsened later received laser photocoagulation after 28 weeks following injection of bevacizumab. So a total of 72 eyes were chosen for this study. 36 eyes were on innovative bevacizumab, and the rest 36 eyes were on the biosimilar bevacizumab. Weekly follow-up was done. If the ROP worsened, we moved to the laser treatment, and if the ROP regressed, we kept the patient to do follow-up until the 24th week. Statistical analysis was used by using SPSS23. Now, in our study of 72 eyes of 36 infants, out of which 36 eyes received innovator bevacizumab and the 36 eyes received biosimilar bevacizumab. The mean gestational age was about 28.9 weeks, and the average birth weight was 1.19 kg. The gender distribution exhibited a modest male preponderance, with the male comprising about 58.3%, and the female about 41.7% of the study group. Now the treatment outcome, by 24th week after the commencement of treatment of the 72 eyes, in the innovator group, 31 eyes had complete regression of ROP. In the remaining 5 eye, additional laser photocoagulation was done. In the biosimilar group, 29 eyes showed ROP regression, and the remaining 7 eyes had to give on additional laser photocoagulation. But all of them displayed complete ROP regression after 24 weeks of commencement of treatment. So our study did show that the innovator bevacizumab and the biosimilar bevacizumab had a very good efficacy, and the safety and there were relatively no safety issues, either ocular or systemic. Of course, anti-VEGF therapy does offer several advantages over laser photocoagulation in our patients, and it is essential to recognize that although biosimilar provide cost saving and are intended to closely match the reference product, they may not be identical. As a result, healthcare providers and patients should collaborate to make well-informed treatment choices on the specific clinical context. Our study is limited by a sample size and a short follow-up period. So to conclude,
Dr. Rahul, please sum up.
Biosimilars are effective and and have got a very good safety profile. Thank you.
The study was very good, but the time consideration is very important.
Yes, ma'am. Yes,
That's all.
that's what we emphasize, ma'am.
Sir, any question from you?
No, good study, but we should be careful while using, bevacizumab in ROP babies, and that too biosimilar of bevacizumab.
Agreed, sir, agreed.
We should be careful.
Yes, sir, agreed.
There are so many medico-legal issues.
Definitely, sir.
Thank
So
you.
documentation is very important.
Of course, ma'am, of course, ma'am.
You must have show the records also, how to maintain the record.
Okay.
So that is very important for the audience also.
Right, ma'am.
So do biosimilars of bevacizumab have DCGI approval in India?
Sir, for ROP still we don't have any approval.
So
So
did you get the ethical clearance for that? Because if you don't have the approval in India for biosimilar bevacizumab in ROP, so that might be a problem.
Yes, sir. Agreed, sir. Anyway.